Hello students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module we are going to discuss about the natural methods of contraception, right? So in the previous module we dealt about what is contraception and what are the different methods of contraception, right? So as promised earlier, now we are going to discuss about the different methods of contraception in detail. So in this module, we are going to deal about everything in detail about the natural methods of contraception. And natural methods of contraception is also a repeated short answer question in your university examinations. So just please hear and just listen what I'm going to tell to you and understand the concept behind this natural method of contraception. So to begin with, this natural method of contraception is relied upon the principle of fertility awareness, which means a female should be aware about her fertile period during her menstrual cycle. So during a menstrual cycle, definitely there is going to be some day of fertile period, right? That is around the time of ovulation, just before and after the period of ovulation, it can be taken as the fertile period, right? So if the female is going to have any act of coitus during this fertile period, it is going to result in conception. So what are you going to do in this natural method of contraception is that you are going to detect the unsafe or fertile period during a menstrual cycle, and you're going to ask the female to avoid any act of coitus or intercourse during this unsafe period of her menstrual cycle. So if she is going to avoid any act of coitus during this unsafe period, then definitely there is going to be no risk of any pregnancy. Is that clear? Yes. So the basic of this natural method of contraception is, depending upon the various methods and tests, you're just asking the female to be aware of her fertile period and just avoid intercourse during this fertile period in order to prevent any pregnancy. Clear? Yes. So to begin with, the first method of natural method of contraception is calendar method or rhythm method. So basically this calendar method or rhythm method is a test of prediction, right? You're just going to predict the time of ovulation during the menstrual cycle experienced by a female. So let's take for an example that on an average, the menstrual cycle duration in most of the female is going to be 28 days. So in a female with 28-day regular cycle, when does the ovulation occurs? So in a 28-day cycle, 14 days prior to the menstruation, ovulation can occur, which means 14 days backwards from 28th day of the cycle, in that particular day ovulation is going to occur. So in order to ascertain which is the day of ovulation, you have to subtract 28, that is the whole total duration of menstrual cycle experienced by the female, minus 14 days. Why? Because 14 days prior to the menstruation, ovulation is going to occur. So 28 minus 14 is going to be 14th day. So therefore 14th day of the menstrual cycle, ovulation is going to occur. But then you cannot be very certain that in every single female ovulation is going to occur on day 14th of the menstrual cycle, because ovulation can occur somewhere between 12th to 16th day of the menstrual cycle. So you can't be very sure about that it is going to occur on day 14th of the cycle. So you are going to give a variable that between 12th to 16th day of the menstrual cycle, ovulation can occur. Now I'm going to ask a question to you. In a 28-day cycle, ovulation occurs on 14th day, right? Because you're going to subtract 28 minus 14, which is going to be 14th day of the menstrual cycle, ovulation is going to occur. But let's say for an example, in a 35-day cycle, when does the ovulation is going to occur? So the whole duration of menstrual cycle in this female is 35 days. So ovulation occurs when? So ovulation occurs about 14 days prior to the date of menstruation. So in this female 35-day cycle, so therefore day of menstruation, that is 35 minus 14, you're going 14 days prior to the day of menstruation. So 35 minus 14 is equal to 21st day. So therefore ovulation occurs on 21st day of the cycle in this particular female. So therefore this method is actually a method of prediction. Right? You cannot be very sure that ovulation is going to occur on this particular day only. You can just give a rough variable that it is going to occur between 12th to 16th day of the menstrual cycle. But if the cycle of the female is prolonged, let's say for example, as we see now, in a 35-day cycle, ovulation occurs only on 21st day of the menstrual cycle. So therefore, the female need to be very much aware about the fertile period during her menstrual cycle. So with respect to discussing the calendar method or the rhythm method, there are certain basics which we need to take into consideration. So what are those? See, we know that during the act of coitus, the male partner is going to deposit the spermatozoa in the vaginal canal of the female. So the actual duration that the spermatozoa can survive in the female genital tract is about 24 hours. So the spermatozoa can survive for about 24 hours. Similarly, the ovum which is released from the ovary during the ovulation, this particular ovum can survive for about 12 to 24 hours. Is that clear? Spermatozoa survives for 24 hours and this ovum which is released from the ovary during ovulation can survive for about 12 to 24 hours. So therefore, it signifies that just prior to ovulation and just after the ovulation, that is a variable between 12 to 24 hours, anywhere between this period, if a female is going to have coitus, then it can very well result in pregnancy. So therefore, the unsafe period during a menstrual cycle can be told like 3 days prior to the date of ovulation and 3 days after the ovulation. Why? Because 12 to 24 hours, both the ovum and the spermatozoa is going to be surviving, right? So any act of coitus during this particular period can result in conception. So therefore, I'm going to give a variable like 3 days prior to the ovulation and 3 days after the ovulation. This is the unsafe period or the fertile period during the menstrual cycle. So you are going to advise the female to please avoid having any intercourse during 3 days prior to the day of ovulation and 3 days after the ovulation. So as you can see in this time bar, I've given like 1 to 28 day. Let me show you here. So here I've given day 1 to day 28, right? Day 1 to day 28. So from day 1 to day 10, which is depicted in green, is the safe period. So any act of coitus during this safe period, it is never going to result in any conception. But then I told you ovulation is going to occur on day 14th of the menstrual cycle in a 28-day cycle. So therefore, 3 days prior to the ovulation, that is 11, 12 and 13, 3 days after the ovulation, that is 15, 16 and 17, are the unsafe period. So any act of coitus during this unsafe period, 3 days prior to ovulation and 3 days after the ovulation, is going to result in conception. So if you want to prevent the pregnancy, please avoid having any act of coitus during this fertile period. So this is the advice which you are going to give to your patient, right? And resuming from day 18th of the cycle till the end of the cycle, again this is the safe period. So any act of coitus, it is not going to result in any conception. So the basic is that the female has to be aware about the fertile period during her cycle, and she also need to take into consideration the day of ovulation in her cycle. Clear? Yes. Now, in order to understand when is the first day of the unsafe period and when is the last day of the unsafe period, in calendar method we have a theory, and this theory is Ugino-Noss theory, right? So this theory tells us that in order to detect the first day of the unsafe period and to detect the last day of the unsafe period, you need to take into consideration certain important things. And what are those? You need to take into consideration the day of ovulation in a female. So day of ovulation in a female is taken into consideration. And apart from that, the lifespan or the surviving span of both the spermatozoa and the ovaries need to be taken into consideration. And you need to take into consideration, so retrospectively, you need to evaluate the cycle length of that particular female. So you need to go 6 months prior to the date retrospectively, and you have to assess which is the shortest duration of menstrual cycle the female has experienced and how much is the longest duration of cycle the female has experienced. So you need to take the shortest cycle the female has experienced in the last 6 months, and you also need to take the longest cycle the female has experienced in the last 6 months. So with the help of this shortest and the longest cycle, you are going to detect the first day of the unsafe period or the first day of the fertile period. So in order to detect the first day of the unsafe period, you have to subtract shortest cycle minus 18. So the shortest cycle which is experienced by the female in the last 6 months minus 18 is going to give you the first day of the unsafe period. Similarly, the last day of the unsafe or the fertile period is ascertained by subtracting longest cycle minus 10. So in order to detect first day, shortest cycle minus 18. In order to detect the last day of the unsafe period, the longest cycle experienced by the female in the last 6 months minus 10. So this is going to give you the first day of the unsafe period during the menstrual cycle and the last day of the unsafe period during the menstrual cycle experienced by the female. So after ascertaining the unsafe period in that female, you have to advise the female to avoid having any act of coitus during this fertile period of the menstrual cycle. So this is the basic of Ogino-North theory with respect to calendar method or the rhythm method. Is that clear? But then one most important disadvantage is that this calendar method has high failure rate, because with respect to prediction only, you are going to ascertain when the day of ovulation is going to happen. So as a prediction, you're going to avoid intercourse during particular days and you're going to have intercourse during certain days. So since it is a method of prediction, therefore this calendar method or the rhythm method is associated with higher failure rates. Clear? Yes. And now, you may have a doubt that how the day of ovulation can be determined apart from this calendar method. So the day of ovulation can be determined by two most important tests. So those are the basal body temperature and the cervical mucus method, which is also called as the Billings method. So first let's take into consideration the basal body temperature. So basal body temperature is nothing but the core body temperature. So why basal body temperature is taken into account with respect to the natural method of contraception is because during the time of ovulation, once ovulation is going to happen, the hormone progesterone is going to come into play after ovulation, because progesterone is produced by the corpus luteum. Clear? Yes. So once ovulation is going to occur in the female, progesterone hormone is going to come into play, and progesterone hormone has thermogenic effect in the body. That is, progesterone hormone can increase the core body temperature of the female by around 0.4 to 0.8 degrees Celsius. To be even more appropriate, about 0.5 degrees Celsius increase in temperature can be expected from the hormone progesterone. So therefore progesterone has thermogenic effect and increases the core body temperature by 0.4 to 0.8 degrees Celsius. So what are you going to do is that you need to check the basal body temperature of the female after waking up every day in the morning. So you are going to advise the female that please, after waking up immediately in the bed itself, you're going to check your temperature, right? See, I have to make sure one important thing. All these methods, right? The calendar method, the rhythm method, the basal body temperature, all these methods are actually done by the couples. That is, it is actually done by the female. We as doctors or clinicians, we have nothing to do with any of this method, because all these methods are natural methods of conception, right? So only the female has to mark in the calendar when is the day of ovulation and when is the unsafe period, when is the period that she should abstain from having any coitus with her partner. So everything has to be decided only by the female. As a doctor, we don't have any point in here dealing with the patient, right? So similarly, with basal body temperature, you ask the patient that after waking up from the bed, immediately before getting from the bed, you need to check the core body temperature, right? So every day, starting from day 1 of the menstrual cycle, you need to ask the patient to check the basal body temperature, right? And one particular day when the temperature is going to shift, right? When the temperature is going to shift by about 0.5 degrees Celsius, that day of the temperature shift is going to tell you the time of the ovulation. So only if ovulation is going to happen, hormone progesterone can come into play. Only if hormone progesterone is coming into play, then it is going to exhibit some thermogenic effect in the body and increase the basal body temperature. So you need to check the basal body temperature after waking up at the morning. This is the advice you're going to give it to the female. So with respect to this basal body temperature, when is the safe and when is the unsafe period? So first 4 days of the menstrual cycle, please remember, safe is equal to 4. Safe is equal to 4. Clear? Right. Now see, similarly we have given here day 1 to day 28 of the menstrual cycle. So day 1 to day 4 of the menstrual cycle is the safest period. Clear? Day 1 to day 4 of the menstrual cycle is the safest period. Similarly, from day 4 after the increase in basal body temperature till the end of the cycle, this is also the safest period. So that's why I told you 4 is equal to safe. So from 1 to 4 it is safe, and from 4th day after the increase in basal body temperature till the end of the cycle, it is also the safest period. So when is the unsafe period? The unsafe period is from 5th day of the menstrual cycle till the increase in the basal body temperature till the first 3 days after the increase in basal body temperature. Is that clear? From the 5th day of the menstrual cycle till the increase in basal body temperature, this is unsafe period. And apart from this unsafe period, after the increase in basal body temperature, the first 3 days after the increase in basal body temperature, so this is again the unsafe period. So anywhere between the 5th day till the increase in basal body temperature and until the first 3 days after the increase in basal body temperature, this period is the unsafe period or the fertile period of the menstrual cycle. So you need to ask the female to avoid having any act of coitus during this period. So for that, the female has to check the basal body temperature after waking up. In the bed sitting itself, she has to record her temperature, and as soon as the temperature is going to shift, she has to be very vigilant that so this is the unsafe period is going to start, right? So now I have to make sure that I'm going to avoid any act of coitus during this period, right? Is that clear? So day 4 is equal to safe. So 1st to 4th day is safe, and 4th day, from 4th day after the increase in basal body temperature till the end of the cycle is safe. And apart from that, the in-between period is the unsafe period. Clear? Yes. So this is all about the basal body temperature. So if someone asks you about basal body temperature, one thing which has to come to your mind is progesterone increases temperature by 0.5 degrees Celsius. Clear? Yes. So now we are moving on to the cervical mucus method. So cervical mucus method is also known as the Billings method. Now you may have a doubt that you told me that with respect to the calendar method, you are going to predict the day of ovulation. Clear. Now again, with respect to the basal body temperature, you are going to check the temperature. You are going to ask the patient to check the temperature. That is the core body temperature. But with respect to cervical mucus, what are you going to do? So cervical mucus method is based on the fact that during the menstrual period, during the first half of the menstrual period, right, estrogen is the hormone which is predominant. And during the second half of the menstrual cycle, progesterone is the hormone which is predominant. So if progesterone is going to come into play, it means that ovulation has occurred. So with respect to the characteristics of the cervical mucus, we are going to determine the day of the ovulation. How? It is because under the influence of the hormone estrogen, the cervical mucus is going to have different characteristics. And under the influence of the hormone progesterone, the cervical mucus is going to have some different characteristics. That is, under the influence of estrogen, the cervical mucus is going to be profuse in quantity. It is going to be very elastic, thin, and it is going to be watery. So since it is thin, elastic, watery, and profuse under the influence of estrogen, therefore, if the female is going to check the cervical mucus, it is going to be stretchable. As you can see in this image, right? The cervical mucus is stretchable between the fingers, right? So it is stretchable because it is elastic, it is thin in nature, it is watery, right? It is watery in consistency, it is elastic in nature, it is thin, and it is profuse. So if it is elastic, it is going to be stretchable. If it is going to be stretchable, it is called as Spin-Barkett test. It is called as Spin-Barkett test. So under the influence of estrogen, the cervical mucus is going to be profuse, elastic, thin, and watery. Since it is profuse, thin, elastic, and watery, it is going to be stretchable between the fingers. So if it is going to be stretchable between the fingers, it is called as Spin-Barkett test. Clear? Yes. And under the influence of the hormone progesterone, the cervical mucus is going to be scanty in quantity, it is going to be viscous and thick in nature. So if the cervical mucus is going to be thick in nature, then definitely this cervical mucus cannot be stretched between the fingers. So if the cervical mucus cannot be stretched, then it is not under the influence of estrogen. it is under the influence of progesterone. So if the cervical mucus is going to be thick and it is not stretchable, it means that progesterone hormone has come into play and therefore ovulation has occurred. But how are you going to do this test is that you need to ask the patient to check the cervical mucus every morning. So every morning after waking up from the bed, she has to take a tissue paper and just wipe the cervical mucus. And this cervical mucus, she has to check the characteristic of the cervical mucus, whether it is profuse, watery, thin, or it is thick, viscous, and she has to stretch it between her fingers. If it is stretchable, it is Spin-Barrett test positive. That is, it is under the influence of estrogen, the cervical mucus is stretchable. But if it is thick and viscous, it cannot be stretched, then it is under the influence of the hormone progesterone. Right? So, with respect to the cervical mucus method, how are you going to determine the safe and the unsafe period? So, similar to the basal body temperature, the dry days or the safe period. So what is dry days? Dry days means during the first 4 days of the menstrual cycle, if the female is going to take a tissue paper and wipe it, there is going to be no mucus. So there is no cervical mucus, those are the safe period. The first 4 days, those are the dry days, and these dry days are the safe period. So day 1 to day 4 of the menstrual cycle are the dry days and these are the safe period or the unfertile period. Right? And from the 5th day of the menstrual cycle till the day of peak of the cervical mucus and till 3 days after the peak of the cervical mucus, this is the unsafe period or the fertile period. So any act of coitus between this day 5 till the peak of the cervical mucus until 3 days after the peak of the cervical mucus is going to result in conception. Right? So you need to ask the patient to avoid having any coitus if the cervical mucus is going to be thick and it is not stretchable. If it is thick and not stretchable, definitely ovulation has happened. So anytime around the day of ovulation, the female should avoid having coitus to prevent any conception. Right? So I told you day 4 is equal to safe. Right? So first 4 days, those are the dry days, those are safe. And similarly, 4th day after the peak of the cervical mucus until the end of the menstrual cycle, these are the safe period. So any act of coitus during the safe period is never going to result in any conception. But during the unsafe period, the female has to avoid any act of coitus to prevent any pregnancy. It is clear, students. See, cervical mucus method, you're going to ask the female, after waking up every morning, you take a tissue paper or you take a paper and just wipe the cervical mucus. You check the consistency of the cervical mucus, whether it is thin, watery, elastic, profuse, viscous, thick, and whether it is stretchable or not. If it is stretchable, it is under the influence of estrogen and ovulation has not occurred until now. If it is not stretchable, it is thick and viscous, it means that ovulation has occurred, and anytime around the ovulation, she is not supposed to have any act of coitus to prevent pregnancy. It is as simple as that. It is clear? So this picture is Spin-Barrett test positive. Clear? Yes. Now coming back to another important method which is called as the symptothermal method. Symptothermal method. So symptothermal method is nothing but a combination of two methods which we have discussed earlier. So symptothermal method is a combination of basal body temperature and cervical mucus or the Billings method. See, it is always better to do two tests together in order to increase the effectivity of the test. Instead of doing only one particular test, if I'm going to combine two important tests and do it, therefore the effectiveness in identifying the actual date around the time of ovulation is going to be increased. So the combination of two methods is always more effective than any single method. So if you're going to combine the basal body temperature along with the Billings or the cervical mucus method, it is called as the symptothermal method. Clear? It is called as symptothermal method. Now coming to the last method of natural contraception is Tirumala method. It is called as Tirumala method. So it is something which is similar to a mala, right? So as you can see here, it is very similar to a mala. So therefore it is called as a Tirumala method. So this Tirumala is basically composed of beads. It is basically composed of beads which you can see in any mala, right? So this number of cyclobeads which are present in this Tirumala is around 32 cyclobeads. As you can see here, I have named it 1, 2, 3, 4 like until the 32 cyclobeads are present in this Tirumala, right? And which is the starting point of this beads is this red one. So this red one is the starting point of the cyclobeads, right? And the end point is the lightish brown, that is 32 is the end cyclobeads. So what is the actual principle behind this test is that this Tirumala is going to have a rubber ring, right? As you can see here, this is the rubber ring. And the major use of this rubber ring is that, see, you might have seen this Tirumala which has been held by many grandmothers, right? They're going to have this Tirumala in their hand and they're going to recite some slokas and they're going to just move each and every cyclobead with respect to each number of recitation. Similar to that, what you are supposed to do is that you need to ask the female, starting from the day of the menstruation, with passage of every single day, you need to just move this rubber ring with respect to each and every day that crosses. Clear? So this red one is the day of menstruation. Menstruation blood is red in color, so therefore this bead is red in color. And this rubber ring will originally be situated here. So if the female is going to experience menstruation on any particular day, that is going to mark the day 1 of the cyclobeads. So she is supposed to move this rubber ring from here to here. So now she has moved the rubber ring to here, that is in 1, right, in first cyclobead. So this is marking the day of the menstruation. So every time after the day of menstruation, as each and every day is going to pass, she has to just move this rubber ring with respect to the day that is passing. So the second day after the day of menstruation, she has to move this rubber ring in the second day, and then after it has to be moved to the third day and fourth day and then fifth day. With respect to each day that passes, she has to move this rubber ring. So this is the basic of this test. So now you may have a doubt that how are you going to identify the unsafe and the safe period with respect to this Tirumala method? It is by, right, the light brown color. Wherever you can see light brown here, those are the safe days, right? Wherever you can see light brown color, those are the safe days where the female can have coitus with her partner. So any act of coitus during this light brown beads color, she can have coitus. It is never going to result in any conception. But all the white cyclobeads you are seeing here, starting from 8th cyclobeads to 19th cyclobeads, these are the unsafe period or the fertile period. So any act of coitus or intercourse during this particular unsafe period between cyclobeads 8 to 19th is most likely to result in conception. So once the cyclobeads, that is once the rubber ring is going to be on 8th cyclobead until the 19th cyclobead, the female has to avoid any act of coitus with her partner. If she's going to have any act of coitus between 8 to 19 cyclobeads, if the rubber ring is going to be anywhere between 8 to 19 cyclobeads, then the chances of conception is going to be increased because the pregnancy is going to be likely due to ovulation has occurred, right? So from 1 to 7 it is safe to have coitus, from 8 to 19 it is unsafe to have coitus, and from resuming from 20th it is again safe to have coitus, which will never going to result in any conception, right? So as you can see here, in this cyclobeads you can have colors like red, light brown, white, and here you can see a dark brown color, right? You can see dark brown bead, and this dark brown bead is going to tell you the length of the cycle. The length of the menstrual cycle is going to be ascertained with this 27th dark brown cyclobead. And you may have a doubt how. See, if a female is going to experience menstrual cycle, that is, if the female is going to menstruate anywhere before this 27th cyclobeads, it is going to tell that her cycle is actually less than 26th day, right? Because the cyclobead dark brown is in 27. If the female is going to menstruate after this first day of menstruation, if she is going to menstruate anywhere sooner before the 27th cyclobead, let's say for example she is going to, wait, let me show you here. Let's say for example she is going to menstruate on 25th cyclobead. If she is going to menstruate on 25th cyclobead, then this use of this 27th dark brown cyclobead is going to tell you that the actual length of this menstrual cycle of this female is less than 26 days. So only if it is going to be less than 26 days, she's going to experience menstruation on 25th cyclobead, right? So if menstruation is going to occur before 27th cyclobead, it tells that the cycle length of this female is less than 26 days. If the menstruation is going to occur after the 27th cyclobead, it is going to tell that the cycle length experienced by the female is more than 26 days. Clear? Yes. So with respect to the cyclobead, we have just revised everything, right? So day 1 is the actual day of menstruation, that is red in color, and from day 1 to day 7, this is the safe period to have coitus. But starting from day 8 until day 19, this is the unsafe period to have coitus. So please avoid any act of coitus in order to prevent any conception. And then resuming from 20th till the end, it is again the safe period to have any act of coitus. But then with respect to this 27th dark brown cyclobead, it is going to tell you the female cycle is either shorter or longer than 26 days. If the female is going to menstruate at less than 27th cyclobead, example 25th, it is going to tell that the cycle length of the female is less than 26 days. If she is going to menstruate at more than after the 27th cyclobead, let's say for example that she is going to menstruate on 29th, then it is going to tell me that the actual length of the menstrual cycle in the female is more than 26 days. Clear? So with respect to the cyclobeads, you can ascertain the cycle length of the female, whether it is less than 26 days or it is more than 26 days. And with respect to the cyclobead Tirumala method, you can also ascertain the safe period and the unsafe period of the female, right? So let me show you here. The total number of cyclobeads is 32. Yes, right. The day of the period is going to be the red bead. Yes. The safe period is the light brown beads. So till 7 and from 20 to 32, these are the safe period. Clear? And the unsafe period is the white beads, that is starting from 8 to 19. This is the unsafe period to have any coitus. And this dark brown bead is going to tell, that is the 27th dark brown bead is going to tell me whether the cycle is shorter than 26 days or the cycle is longer than 26th day. Clear? Yes. And this dark brown bead's position is the 27th cyclobead, is the dark brown cyclobead with respect to the 32 beads containing cyclobeads. So this is the entire detail about the Tirumala method. So with this, I'm going to just conclude this module where we have discussed about the natural methods of contraception. I hope I made this discussion very clear and concise for you. In case if you have any doubt, please write to me in the Mackler Gmail handle. I will reach out to you as early as been possible. And please don't forget to subscribe to the Mackler YouTube